Let's cross over to Nyeri County, where Martin Munene is there. Martin, you told us yesterday that you are hoping there would be a decision by the nurses and as far as whether the strike should commence or not. What was that decision and what is the situation like in the hospitals of Nyeri?
All right, a very good morning to you, Sam Getuko. We're coming to you from the Nyeri Referral Hospital. Actually, as you can see behind me, quite a number of people here. This is the outpatient department in this particular hospital, Sam. We have not been able to access the inpatient department, which is actually more dependent on nurses compared to the outpatients. What I can say is that this morning, residents of Nyeri actually did come to hospitals like it is expected or like normal, and as you can see, services are quite a bit slow, and the reason is because yesterday nurses decided that they are going to actually go on strike. This morning I've spoken to one of the officials, and they have confirmed to me that the strike is officially on, and the grievances, they say this time is purely about money. They say that the county government of Nyeri owes each and every single nurse in Nyeri 3,000 shillings per month for the past 7 months, and 5,000 shillings extra for their uniform allowance. So in total, every nurse in Nyeri says that they are owed 26,000 shillings. And now, after yesterday, they resolved and decided to actually go on strike. Later in the day, there was communication from the county government of Nyeri saying that they have, especially from the Department of Finance, saying that they have the monies to pay the nurses. But the nurses this morning were saying that they are not ready to accept any form of promise unless it's on paper. They sit down and have a deal with the county government. They say they've done this previously and it has not worked to their favor, and therefore some from Nyeri County, I can confidently say that the nurses are on strike, and the nurses who have not yet gone to strike are nurses who are said to be nurses in charge, for example at PGH here, and I understand that the nurses are going to be having a meeting later where they're going to be issuing a statement on their stand. But on phone, having spoken to the branch secretary Beatrice Ndwati earlier today, she has confirmed that her nurses are on strike. And when we got here at first, we found quite a number of nurses here not on their workstation. They were actually around this area where I'm standing, saying that they're waiting for direction from the branch officials. But as we spoke to them then, they were not working. Therefore, the strike is on in Nyeri County. We're not sure if they're going to have a sit down with the county government today and if they're going to call off the strike. But as it is right now, operations are quite slow. We have not yet gone to the inpatient, and like I said, a lot of outside here, the outpatient, they do not really depend entirely on nurses, because we've got clinical officers and the rest. But people who are in the wards do depend on nurses quite a lot, and we're going to be going there. We have also some information, that some of the nurses who actually came here, some officials who came here, were here to ensure that no nurse is working, and so we are told that they were going around telling patients that the patients need to leave because they are not going to be attended to by the nurses, telling people who have their patients here to take them away. But before we are able to have these nurses actually on record saying that they are not going to work, what we have is just a phone conversation, and the fact that we actually literally saw some of the nurses here and then they walked out to a meeting that we are yet to confirm the venue. But as it is, the nurses insist there is no deal with the county government of Nyeri, and the strike is still on. Back to you in studio, Sam.